So I'm going to be initiating a catheter on my patient. I verified my doctor's orders, I verified my patient, and if they have any allergies, specifically latex. And I have performed hand hygiene, donned clean gloves, I performed perineal care before I put in the catheter, take off my gloves, and perform hand hygiene again. Now I would put clean gloves on again, but for time purposes I'm not. And I would open up my sterile package. So I have put my patient in supine position. And since we're doing a male, for a female catheter, you would lubricate the tip 1 to 2 inches on the catheter and then insert 2 to 3. And then as soon as you got urine return, you would advance the catheter 1 to 2. But for the male, you'll lubricate the catheter 5 to 7 inches and then put the catheter in all the way to the bifurcation. So as I said, I have gloves on. I'm gonna take these off. So I can set up a sterile field with clean gloves, only touching the 1 inch border. This is very difficult to put under a mannequin, but in the real world, I could just ask them to lift their bottom. And then I can do this. Okay, and now I would take off my gloves, perform hand hygiene, and then put on my sterile gloves. Okay, so I can set up my sterile field. I can do this. Okay, so I'm going to lubricate the tip of this catheter 5 to 7 inches. Oh, that's good. And then I can, open my alcohol sticks. And I would just take one. So I'm gonna contaminate my non-dominant hand. I'll just get an alcohol swab, do it 3 times in a circular motion. And then after I've lubricated the tip of my catheter, I'll just, let's stop doing that. Go 1, 2, 3. Bear down. There we go. Okay, then I can do that. And then I would inflate the balloon, tug to make sure that it's in there correctly. And then I would hang the bag on the bed frame and not the bed rails. And then I can secure it on the thigh or on the lower abdomen. And then for inserting the catheter, I could document that it was a 14 French Foley catheter. Any type of observation of the perineal skin, that perineal care was performed, that we did see urine return, what the characteristics of the urine were. For demonstration purposes on the catheter care, I'm not going to be taking all of this off. We're going to say that I took off my gloves, I've documented, performed hand hygiene, donned new clean gloves. And for catheter care, I would unsecure the tubing from the thigh, and then I would have a cloth with warm water and soap. And so I would retract the foreskin if need be. And each time I did a circular motion, I would just use a new flap like this. And then for the tubing, I just hold it with my forefinger and my thumb and use a new flap, go 4 inches down. And then you could rinse it off with water, secure it again, secure it back, and then you would document the procedure and how the patient tolerated it.